a number from Debayon Banerjee, a number from Varun Pathak, and a number from Prashant Saraf. One of you is yet to send me a number. Who is left? Can one of my fellow OC members please tell me who's left?
Yeah, I'm left. Just a second.
Paras Arora.
Okay,
Paras
sure,
Arora.
sure.
One to 100, right?
Yes, 1 to 100.
Any number.
If you could send that.
Did you receive?
No. You can say your number. Since we have 5 numbers, you can tell me your number. No issues.
9769.
It should be a number between
1 to
1
100.
and 100.
Okay, 7.
Okay, fine, 7. Okay, so you're Paras Arora,
Yeah.
right?
Yeah.
Yeah, so you're first. Paras Arora. Sahasra, take note, please.
Yes, I'm doing.
Paras Arora 1. Second is Ame Ambike.
Okay.
Third is Varun Pathak. Fourth is Debayon Banerjee.
Okay.
Fifth is Prashant Saraf. Yes, Prashant Saraf. And sixth is Harsh Marathe. Participants, are you clear with your order?
Yes.
Okay, then that's fine. A self bounce, like I said. So, say there's a very easy question which you have got. You see all the other 5 participants can pounce on it, right? So that would put you at a disadvantage of not getting that extra 5 marks. So we have allowed you to pounce on your own direct question. You're risking that extra 5 marks. You're risking a negative 10 for that extra 5 marks. If you answer your direct question as a direct question, you're getting 10 marks, but you have no risk of an incorrect answer. For the pounds, you need to private message me for my rounds within 10 seconds of me ending saying the question. Right. So I finish saying the question. I'll give you 10 seconds. You pounce, and then the answer will be decided on that. And yeah, are the rules clear?
Are the rules clear for everybody?
I had a question actually.
Yes, please.
Suppose if on a question the person who's answering isn't able to answer, and about 3 to 4 people pounce on that. So each of them gets marks, or the one who pounces first gets the marks?
No. Everybody who pounces within the 10 seconds will be getting a plus 15 or a minus 10 based on the answer.
Correct. Yeah, right. Thank you.
And if you have to go for a self pounce in your direct question, you must make it. You must make sure that you are typing the answer within the 10 seconds. You have got 30 seconds, but within the first 10 seconds, you have to type the answer. Only then that will be counted as a self pounce. If you speak out the answer within the 10 seconds or within 30 seconds, then it will be counted as a direct answer itself.
Right.
Yes. So
please
if
confirm
it's a
the
direct,
number once.
I also had to ask. We had to direct answer by saying, right?
Yes.
Direct answer is by unmuting yourself. You will be unmuted yourself. You will keep yourself unmuted and answer. That will be counted as a direct answer, and you will have a plus 10 and a 0. But if you type it within the first 10 seconds, then only it will be counted as a pounce or a self pounce.
And
One last
someone
doubt.
please,
If I
Yes.
pounce, self-pounce, and I am wrong, so can I have another answer in the remaining 20 seconds?
No.
No, you do
If
not.
you pounce and you're wrong, it's a -10.
It's a -10.
Okay, but if I speak the right answer in next 20 seconds, it is not going to be
No, no, no,
nullified.
that-
No,
If you
no. Once you
answer, that's
pounce, you
done.
lose. Okay. Yeah,
Yes,
exactly.
please. Yes, please.
Once you pounce, you lose your
Okay.
chance on the direct question. If it's your direct.
Souryadipta's number, can you please tell me once? Because if I pounce after,
Your
yeah,
I can't see your name, unfortunately. Paras Arora. Okay, you're number 1.
yeah. So
That's
your phone number, because I have to pounce, right?
Oh, you send it to me
No,
via
you have
Zoom's
to
private chat.
message on the Zoom itself.
Okay,
On
okay.
Zoom itself.
Zoom itself. Okay, fine.
Yes.
Oh.
Yeah. So, like general advice, for each round, you change your private message to either me or to Atharva. Right.
Yeah.
So it's faster.
Do take
Are
care.
there?
Don't send it to everyone. Please take care about that.
Do not send it to anybody because it would be
Yeah.
difficult for us. Either send it to the quiz master itself. If it is me, Atharva Batwe, send it to me. For even rounds, 2, 4, 6. And for odd rounds, 1, 3, 5, send it to Souryadipta Majumdar.
Yes. Are there any questions about the rules?
If there are any, please ask. If there are not, we'll move with the first round.
Okay, then the first question of SAMSA preclinical quiz finals, Atharvada, if you will.
Yes, definitely. So the first round is Souryadipta, take
What's
over.
that syndrome? You have to name the syndrome. Rules stay the same. This usually occurs in patients recovering from a myocardial infarction. This syndrome is characterized by fever with chest pain. Clinical findings reveal a pericardial effusion with an auscultatory friction rub. Your count starts now.
Pounds time is
This
up.
is over. Yes. Thank you, Shivani. Direct question to participant 1. Your answer.
Do not hesitate to answer a direct question. It does not cost you any negative.
Atherosclerosis.
Pardon?
Atherosclerosis.
No.
So,
You have to name a syndrome, right? So, Shivani, I think.
Time's up. Yes,
time's
Bhaiya,
up.
time's up.
So the
answer is Dressler syndrome. So it's a classical autoimmune finding seen after myocardial infarction, where not only like it's a complication of myocardial infarction, where you can get autoantibodies attacking both the heart musculature and the pericardium, leading to a fibrinous pericarditis. You are close with that. I've got to give it to you, which leads to the effusion and the friction rub. Is that clear, Paras? Okay. We then moving forward to Ame Ambiki. Are you ready?
Yeah, I'm ready.
Okay. Atharvada, if you will, question 2. A connective tissue disorder. This syndrome is characterized by hyperflexible joints. It also has arachnodactyly as an external clinical feature. Aortic dissection is a common precipitating symptom. On the ocular aspect, it causes an upward dislocation of the lens. What is the syndrome?
I can answer right now.
Give me a minute. Pounce is going on.
Pounce time is up.
Okay. Okay.
Yeah.
So, Sasha, take note. I'm telling you who are correct and who's wrong. Harsh Marathe, sorry, very sorry. Participant 6, he gets -10. Paras Arora, participant 1, gets +15. Debayon Banerjee, participant 4, gets +15. Prashant Saraf, participant 5, gets +15. Oh yeah, that's it. Sasha, you get that down?
Amey, do you want to answer?
Yeah, I want to answer. It's
Yes,
Marfan
please.
syndrome.
Go on. Yes, perfect.
Marfan syndrome.
It is Marfan syndrome. You get
Souryadipta,
+10.
I'll suggest that after the 30 seconds are over, only then you talk about the pounce round. That would be better, I think.
Yes, Bhaiya. It will be
Then
easy
it will
to
be
keep the
difficult for
track.
keeping the track of the time.
Okay, sure. Sorry for that.
So I get this, right?
Yeah,
you get +10.
You do get it, +10.
Thank you. Yeah.
So the answer is Marfan syndrome.
So, Sahasra, are you done with the scores? Sahasra?
Yes, that are noted. All the answers are noted.
Okay, perfect. So now question for participant 3, Varun Pathak.
Yes.
Question 3. This may occur in mothers after severe blood loss during parturition. Presenting as an endocrine problem, there is absence of lactation and later on absence of menstruation. The mother often complains of cold intolerance. Pounce time starts now.
Pounce time is up.
So, what's your answer, Varun?
Hyperthyroidism.
I'm sorry, that's wrong. You have to name a syndrome, right?
Time's up, Bhaiya.
Okay. So I'm sorry, Varun, you don't get any marks on direct. And before I reveal the answer, let me just, Sasha, so Varun gets 0 in direct,
Okay.
right? Participant 6, participant 1, and participant 2, they get +15.
Noted.
That's it. So the answer is Sheehan syndrome. So the thing is, if there's a particularly bad hemorrhage during parturition, uh, the resultant blood loss will cause a pituitary infarction. So that causes the syndromes of absent lactation following that absent menstruation. And yes, you were sort of correct with hypothyroidism, because it does affect the thyroid later on, because the pituitary secretes TSH, as you must know. And with that, participant 3 is done. Moving on to participant 4, Debayon. Your question is another collagen defect. This syndrome is multisystemic in presentation. It causes hereditary nephritis, a sensorineural hearing loss, retinopathy, and lens dislocation. The symptoms can easily be remembered with the maxim can't see, can't pee, can't hear a bee. Your pounce time starts now.
Pounce time is up.
Pounce is over. Yes. Yeah.
Is it Alport syndrome?
Yes, perfect answer. Can you explain how?
Because
brownie points.
Alport syndrome generally presents with a triad of anomalies, which is, hematuria, a sensory neural hearing loss, and lenticonus.
Yes, exactly. Perfect answer.
Defect in type 4 collagen.
Exactly. Perfect. So participant 4 gets plus 10. For the pounces, participant 5 gets plus 15. Participant 6 gets plus 15. Participant 1 gets plus 15. And participant 2 gets plus 15. Have you got them down?
Yes, it's noted.
And participant 4 is a direct plus 10. Yeah.
Yes, done.
And fine. Now participant 5, Prasant Sharaf. Your question is, this can arise as a result of injury to the nerve pathway from the brain to the face. Whatever be the cause of injury, it is classically unilateral in nature. There is a triad of ptosis, meiosis, and anhydrosis. There is also a delayed light reaction in the affected site. Your pounce time starts now.
Pounce is up.
Okay. Okay. Thank you, Shivani. Can I have your answer?
Yes.
Participant 5.
Oculomotor nerve palsy.
Okay, this is syndrome. Right. It has to have syndrome at the end of it. Very specific name and a syndrome.
Horner syndrome.
Yes, correct. Was that a guess?
Time's up.
Yeah, he answered Horner syndrome. So I'm just asking, was that a guess?
No, means I guessed Horner's from ptosis, meiosis, and anhydrosis. But first,
Yes.
I was confused because nerve injury from going to brain to face was mentioned. So I thought a cranial nerve might be involved. But then ptosis, meiosis, and anhydrosis,
Exactly.
I thought Horner's.
Well, the sympathetic nerves are nerves going. Right. So yes, it is Horner syndrome. Atharva, the answer, please. Yes. So your participant 5, yes, participant 5 gets plus 10 for his direct.
Noted.
And participant 4, participant 1, and participant 6, they get plus 15. High scoring
I'd
round
just like
indeed.
to say I had sent you the pounce. I had sent you the answer in the pounce time. I just wanted to ask that.
Wait, Varun. Oh, participant 3 as well. 3, 4, 1, 6. 3, 4, 1, 6.
Noted.
They get plus 15. Right? So for the last question of this round, sitter indeed, Atharva. A syndrome characterized by a short stature and webbed neck externally. Further examination might reveal streak ovaries, congenital conotruncal heart disorders, horseshoe kidney, and extensive lymphedema. Genetic studies will show a gross defect in sex chromosomes. Pounce time starts now. Pretty sure everyone will get this via pounce. If you're self-pouncing, do tell me, Harsh.
Pounce time is up.
Okay. Okay, then let me just check once. 1, 2, 3, 4, 5, 6. Yes, I think all of you have answered correctly. So, Sash, all of them get plus 15. And how the answer? Harsh, hello.
Yes.
What's the answer?
Self pounds, I have to again tell the
Yeah,
answer.
yeah, you've got your plus 50. This is just formality now.
Turner syndrome.
Yes,
Turner
correct.
syndrome.
And all participants have pounced and got their plus 15s. So with that, it's the end of my first round and over to Atharva. I'd request all the participants to change their private messages from me to Atharva. Right? Over to you, Dada.
Okay, thank you, Shaurya. So there was a bonus question. Okay, let's keep it there later. Okay, so round two. So round two is congenital defects and anomalies. The first round was based on physiology. This is anatomy. Okay, so let's see how many of you are good at. You were all good at syndromes. Let's see how much you know about the anomalies as well. The round two also has the same rules as we have already discussed for round one. Although there is a slight difference from round one, there are all the MCQ questions in round two. Okay, they're all multiple choice questions with 4 options and 1 correct, single correct answer. So the timer for the pounds will start as soon as I end the question. I will be reading out the options, but the question ends and the timer starts. Be careful that the question ends and the timer starts.
I have a doubt once.
Yes, please.
Yeah, I also heard it.
There are 2 names of yours, Atharva, I guess.
Okay, yeah,
so which
sure.
one to use?
1 minute. I'll just tell you.
Dada, you can put like a QM.
Yeah, I did that.
Beside the,
I did that. I just did that. So I think now you will be able to differentiate, guys.
Yeah, one more thing.
Yes.
When we pounce, do we have to write just type the 1, 2, 3, or 4 or A, B, C, or D?
Yeah,
or the
just type A, B, C, or D because there will be only 4 options. Okay.
Right.
Even if for self pounds, you just have to name the option. That's it. So it's like a time bonus also.
Right.
So I think we are ready for the first question. And since the last round started with Paras Arora, participant 1, this round starts with Ame Ambike. Is it fine? Yeah. So Ame Ambike, are you ready with the question? Are you ready for the question?
Yeah, I'm ready.
Okay. So the question is this: a neonate has breathing difficulty and scaphoid abdomen. The mother of this neonate had a history of polyhydramnios, that is a lot of amniotic fluid during her pregnancy, and defect in which of the following during embryological development could most possibly result in this condition? Pound starts now. Option A, pleuroperitoneal membrane. Option B, mesoesophagus. Option C, septum transversum. D, none of the above.
So I can
time
answer.
is up.
Okay. So now you can answer if you want to. Yeah, please.
Yeah, I'll go for septum transversum C.
You go for septum transversum C. And I am afraid, friend, but that is the wrong answer. So it's a 0 for you.
Yeah.
And I'll just check which of the participants have given the right answer. So Harsh Marathe has given the correct answer. None of the other participants have given the answer for this question. Harsh Marathe, you are absolutely right. It is the pleuroperitoneal membrane. So Sahasra, I would like you to give Harsh Marathe, participant 6, a plus 15, and participant 2 will get a 0 for this round.
Okay, Dada, noted.
So after this, we come to Varun Pathak, number 3, participant number 3. Are you ready, Varun?
Yes.
So the question to you is, a mother brings her 6-month-old baby to the OPD with her complaint of cyanosis on exertion or crying, especially after getting up in the morning. A chest X-ray was performed and the heart appeared a boot-shaped heart in double quotes, as shown in the figure. What is the cause of the developmental defect that has occurred? The pound time starts. Option A, non-spiral course of the spiral septum, anterior displacement. Absent aorticopulmonary septum, all of the above.
Pounds time is up.
Okay. So do you want to answer your direct question, Varun? Your time has...
Yes, I think it's option D.
You say it's all of the above?
Yes.
Well, is this your final answer?
Yes.
So logged it. Okay. So it is the wrong answer, I'm afraid. So you scored a 0 for this round. I'll just quickly check the other chats. Okay, so Prashant Saraf and Harsh Marathe both have messaged me option number B. So let's see whether it's correct or not. And it's anterior displacement of the spiral septum, which is the correct answer. So I would like you to give them marks for this.
Dada, could you repeat Harsh Marathe and?
Harsh Marathe and Prashant Saraf, that's participant 5 and 6. They get plus 15. And third participant, Varun Pathak, he scores a 0 for this round.
Noted.
Okay, so actually the spiral septum, if it's when it goes anteriorly, if it displaces anteriorly, what happens is that because of that anterior displacement, there will be an issue leads to the tetralogy of Fallow. If you have heard of TOF, tetralogy of Fallow.
Yes.
So this is that boot-shaped heart is the absolute characteristic feature on radiology for a tetralogy of Fallow. So that is the reason. It's a tetrad of 4, you know?
Yes.
So that is the thing. So the participant 4, Diban Banerjee, are you ready for your question? Direct one.
Yes.
So your question is, a baby is born with a defect as shown in the picture. What is the defect? Your time starts. Pounds. Option A, omphalocele. Option B, gastroschisis. Option C, incisional hernia. Option D, protrusio intestinalis.
Pounds time is up.
I think, Debayan, you have pounds for this round.
Yes, I have.
And let me just once check. I think all of you have answered correct. Most probably, let me just check. So, okay, except for Varun Pathak, that is participant 3, who gets a minus 10. All the other 5 will be getting a plus 15 for this answer. Noted?
Noted.
So the answer is gastroschisis, because there is a reherniation of after the complete rotation is done, the first, second, and third rotation, the loops are inside the abdomen. But then due to an anterior abdominal wall defect, it reherniates out the midgut loop. And that is causing the gastroschisis and not protrusio intestinalis. It is actually a made up word. It's no such word as there. Nothing exists as such. Okay. So Varun Pathak. Okay. So the next question goes to Prashant Saraf, participant 5. Are you ready?
Yes.
So the question is this. A patient comes with painless rectal bleeding. On examination, a slight bulge in the small intestine is found to be present at birth, which is a vestigial remnant of the omphallomesenteric duct. What is the defect? Pounds time. Zenker's diverticulum, enterocele, Mecker's diverticulum, or diverticulosis of intestine.
Pounds time is up.
Okay. I'll check. You can answer. You still have the time.
I have pounced C.
Okay, you have pounced. Let me see. Yeah, you have pounced. And the answer is correct to be C. So I'll tell Prashant Saraf gets a 15. Paras Arora gets 15. Amey Ambike gets a negative 10. Harsh Marathe 15 and Varun Pathak 15. Is it noted, Sahasra? Or should I repeat?
Dada, you could repeat. I just recheck once.
Sure. Paras Arora plus 15.
Noted.
Prashant Saraf 15. Amey Ambike is at -10 for this. And Harsh and Varun Pathak, both of them get a +15 because this is a Michel's diverticulum.
Right. I would like to point out one thing. Prashant, your camera is not pointing towards you. Please align your...
Actually, is it so?
Now, if you can view.
Yeah.
Yes, can see.
Yeah. This is
Okay.
better.
Actually, I am not able to view myself on the screen, so I am not able to adjust the camera.
Okay.
Okay, it is fine now.
It's fine now.
You tell me if it is having problem. Okay, I will adjust.
Okay. So then the second last question of this round is for participant 6, Harsh Marathe. Are you ready?
Yes.
Okay. So the question is, a newborn child has difficulty in swallowing. The infant also presents with small amount of upper GI bleeding. CT angiography was done and it revealed dysphagia lusoria. What is the cause of this condition? Pounds time starts. Aberrant brachiocephalic trunk, aberrant right common carotid, aberrant right subclavian, and aberrant ascending aorta.
Her pound starts C.
Pounds time is up.
So I think Harsh has pounced in this question. So yeah. Okay, so all of you are correct. I mean, the 5 participants have answered and all the 5 are correct. Paras Arora, Prashant Saraf, Deba and Banerjee, Harsh Marathe, and Varun Pathak. All the 5 get +15. Amey Ambike has not answered. Apart from that, all of them are getting +15. Sahasra, is that noted?
Yes, it is noted.
Okay. So the answer is the aberrant right subclavian artery, because the aberrant right subclavian artery, it passes over the esophagus sometimes, and it does pass over the esophagus and compresses it, which leads to the dysphagia known as dysphagia lusoria. Okay, so the last question of round 2, I think all of you must have been tired of anatomy, most are. So I won't haunt you with anatomy anymore. The last question comes to Paras Arora. Are you ready? Paras Arora?
Yes, I'm ready.
You are ready? Okay. So the question to you, direct one. What is the cause of this congenital defect? Time starts.
Should I say the answer?
Wait for the pounds first.
Pounds time is up.
Okay, now you can say.
B.
Are you sure? Do we lock it?
Yes.
Okay, so you say B. After normal first rotation, there is a 180-degree clockwise. You say that? Okay. So let's see who has given the chat. I think it was Varun Pathak. Varun Pathak, you have answered twice.
No, I answered just
no,
once.
sorry.
That was,
the
I think,
previous
okay.
answer. It was the previous answer. I'm sorry. You have answered A. Okay. So does anybody just want to guess what's the answer? There won't be any marking or anything.
B. Maybe B.
Maybe B. Anybody else? Apart from the 2 who have answered.
C.
Okay, that's done. The answer is abnormal second and third rotation. That is option number A. Okay. So in that condition, the direct question was to Paras Arora, and he gets a 0 for the answer. Okay. And Varun Pathak was absolutely correct in his pounds, so he gets a +15. Is that noted, Sahasra?
Yes, it's noted.
Okay, so that was the last round that was haunting you probably. And over to you, Souryadipta.
So before I begin my round, Sach, will it be possible to have the scores up on the screen?
Yeah, that would be better. Let's have the scores for the rounds. 2 rounds.
I could announce though.
Yeah, you can please announce.
Yeah.
You could just give me a second.
Yeah, sure.
So at the end of the first round, the score stand as leading. We have participant number 1, that is Paris Aurora, and he has a total score of 120. Then we have with a score of 125, that is Harsh Marathe. And then we have with a score of 115, that is participant number 5, Prashant Saraf. And then we have with a score of 65, and it's actually a tie between the third and the fourth participant, that is Varun Pathak and Debayan Banerjee. And for now, at the bottom, we have Amay Ambike with a 60 point.
60.
60.
Okay, thank you. And this is the sum of both the rounds, right?
The sum of both the rounds. Yes.
Okay, thank you so much, Sahasya. Okay, physio done, anatomy done. Time for the last one, biochem. So for biochem, you have to name the enzyme deficient. Points will not be given for naming the disease. Please note that. Points will not be given for naming the disease, only for naming the deficient enzyme. And before we begin, I'd like to ask the participants to change their private message from Atharva to me, Souryadipta. Once that's done, we can start. Yeah, Harsh, that's right. Are the rest 5 of you done? If you could just send me a Y on the chat. Yes, Paras, thank you. Amay, thank you. Prashant, thank you. Debayon, thank you. And I think that's all of you. Yes, Harsh, Paras, Varun, Amay, Prashant, Debayon. Yes, that's done. So rules same as before. Pounds applicable plus 15 minus 10, direct is plus 10, 0 pounds within 10 seconds, and the remaining question you get 30 seconds to answer. So with that brief discussion, let's get into the question 1. We'll be starting
I had a
with
doubt.
Yes.
I had a doubt. Is this another MCQ round or not?
No, this is a subjective round.
Okay.
You have to name the enzyme deficient, right?
Yes. Thank you.
Sure. So we'll be starting with Varun Pathak. Varun, are you ready?
Yes.
Okay, Atharva, question 1, if you will. A newborn presents with severe acidosis, vomiting, hypotonia, and neurological deficits. Lab tests show elevated levels of lactate and alanine in blood. Which enzyme is most likely to be deficient in this case? Pounds time starts now.
Pounds time is up.
Okay, thank you. Prashant was on the border, but yeah, sure, I'll take that attempt. It was almost within 10 seconds. So do you have an answer, Varun?
Alanine transaminase.
No. I mean, I'm sorry, but I don't think you're close either. Sorry for that. So the answer is pyruvate dehydrogenase deficiency. So due to that, there is the lactate buildup, and further on, there is the increase in alanine in blood, and the lactic acidosis will cause the clinical symptoms as you have seen. So Varun, I'm sorry, you get 0 for that. So Paras, that's a correct For us, participant 1 gets a plus 15. Harsh, I'm sorry, that's a minus 10. And Prashant, yes, you're correct. It's a plus 15. Sashra, have you taken note?
Yeah, Dada, could you just repeat?
Okay, participant 1, 15.
Yes,
Participant 3, 0.
noted.
Participant 5, 15.
And participant 6 minus
6
10.
minus 10, yes.
Noted.
I have a doubt that we can use the short forms, right? The official ones.
Yes, sure. So with that, we move on to the second question for participant 4, Debayon Banerjee. Atharvada, if you will. A 15-year-old boy presented to the OPD with recurrent cases of muscle cramping right after he starts exercising. If he rests for a few minutes after the cramps, he is able to continue exercising for longer. A few times he has passed brown urine after an episode of such cramps. Lab tests show elevated creatine kinase and normal blood glucose levels. Pounds time starts now.
Pounds time is up.
Thank you, Shivani.
Is it muscle glycogen phosphorylase?
It is muscle glycogen phosphorylase, and 10 points to you, Debayon.
McArdle's cell.
Exactly.
Perfect.
So Varun and Prashant. So 3 and 5, they get plus 15 for this. Sastra noted?
Yes, noted.
Okay. It was just to provide a little background. This case was taken from a Netflix series called Diagnosis, and I'd request everyone in the audience to check out that series. It's really something great. And with that, I'll move on to question 3 for participant 5.
Can the other
Prashant
quiz
Saraf.
master? Can the other quiz master watch that that series, or it is only for the audience?
It's for everyone, Dada. It's on Netflix.
Okay.
Excuse me.
So the next
actually,
question.
can I join with my other phone because my webcam is not working suddenly?
Okay.
Okay.
Who is this?
I'm Paris.
Okay, so you can't turn on your camera.
Yeah, the webcam is a bit issue.
Okay.
You joining
Dada, I don't think
device?
we can proceed with a
Yeah, we
closed
should-
camera.
No, I'm
Yeah,
using
we
another
cannot.
phone. I'm using another phone.
He's
Yeah,
using
sure.
another device. Okay then.
Yeah, sure. We can
We'll
wait
wait for you.
for him to join us.
Yes.
So just on a normal basis, participants, how do you find the questions?
Are they very difficult, or are they very easy, or are they good?
Yeah, good. Questions are good.
Yeah, they're good.
They are exact to the difficulty level that we can
Yeah,
answer.
because from round 1, I got a bit scared. Like almost everyone was pouncing on each and every question.
Exactly.
The scores are so high, it's difficult to keep them right now.
I
Paras, are you
think
in?
Paras has joined. Let's just see.
You need to turn on your video. Yes, perfect. So
Okay.
I think it was Prashant's question now. Question
Yes, it is.
3.
Yes.
Yes, it is.
Yes. So Atharvada,
Shall
question
I?
3. Yes.
Okay.
A 2-year-old boy has a past history of splenomegaly, mental retardation, foam cells in bone marrow, and other neurological deficits. Ophthalmoscopy reveals cherry red spots on the macula. The child unfortunately dies by the age of 3. Pound starts now. And this has a very close differential, which I won't take for the pounds.
Pounds time is up.
Okay.
Okay, so Prashant, do you have an answer?
Yeah, I have pounced.
Okay, sorry, I missed
Sphingomyelinase.
that. Exactly, that's correct. So you get plus 15 as well as your successor Harsh. So 5 and 6, they get plus 15.
Excuse me, I have also sent it to you.
Oh, Ame, sorry. Yes,
Yeah.
participant 2, 5 and 6.
Noted.
So Atharva, Prashant, can you explain the pathophysiology of the disease?
Yeah,
Brownie point.
in the sphingomyelinase deficiency, there is accumulation of sphingomyelin in the various tissues, which led to the characteristic symptoms like splenomegaly, and the disease is Niemann-Pick disease.
Yes,
Oh, yes.
nice, perfect.
Absolutely.
Okay, so the question for Harsh, the fourth question, Atharva. A 3-year-old adopted child is brought to the OPD for history of severe intellectual disability. He hurls himself into walls and chews his lips and fingers so severely that he has to be restrained. He also complains of joint pain. Lab tests reveal very high amount of uric acid level in blood. Pounds time starts now.
Yes, I have pounced.
Okay, I think all of you have pounced. Varun,
Pounds
Paras,
time is up.
Harsh, Debayon, Ame, Prashant. Yes, that's all of you. And all of you get plus 15. Man, you're embarrassing me. Yes.
HPRT.
Yes, exactly. It's brownie points for naming the disease. Anyone?
Leishman syndrome.
Leishman.
Yes, correct. So question 5, the penultimate for participant 1, Paras. Are you ready?
Yes.
So Atharva,
Okay. On it.
a 25-year-old presents to the emergency with severe abdominal cramps. After a breakup, he has consumed 2 tubs of ice cream in his grief. He feels bloated, has flatulence, and severe watery diarrhea. Tests show a reduced stool pH and reduced pH of breath.
I have pounced it.
Pounds time. I'm ending the pounds now. Yes. Let me just check. Amay, did you send the pounds right now?
I sent it to you about 5 seconds ago.
Okay, I'll take it. So Paras, Varun, and Amay plus 15. So that's participant 1 plus 15, participant 3 plus 15, and participant 2 plus 15. Yes. So Paras, what's the answer?
Lactase deficiency.
And pathophysiology, if you can.
Because lactose cannot be converted to galactose and glucose, so it cannot be absorbed. So there is increased osmotic pressure, hence the diarrhea and the flatulence and all.
And can you explain reduced stool pH and pH of breath?
Probably because the bicarbonates are released in the diarrhea.
No.
Okay, the stool
It's
pH.
because
Yeah.
It's due to the bacterial degradation of the unabsorbed lactose.
Okay.
Which leads to production of acids like lactic acid.
Oh, right, yeah.
So there's the pH and breath. So Atharva, the answer and
yes,
our last question.
So
last participant, Amay.
Yeah.
Are you ready?
Yes, I'm ready.
Okay, Atharva.
Okay, there it is.
A 2-week-old infant is brought to the OPD. She has been vomiting and is listless. She had a seizure last night. Clinical exam shows failure to thrive and dehydration. Blood tests reveal a metabolic acidosis with pancytopenia. Sorry for the spelling. Genetic testing shows absence of PCCA and PCCB genes. Pounds time starts now.
Pounds time is up.
Okay, so for the first time, I think no one has pounds for a question. Amay, do you have an answer?
I don't have any idea.
You can guess. I mean, there's no risk right now.
No, I can't even, like, yeah. Caesar.
Time's up.
Yeah.
Anybody wants to guess anything, like the participants?
Well, I'll give you a hint. Vomiting, listlessness, that's fine. You have metabolic acidosis with seizures, right? So that shows something something of a, like, some metabolic defect, obviously, which causes acidosis as well as neurologic defects, because acids can't cross the blood-brain barrier. So
LDL.
that's one. No, you're close, sort of close. Okay, Atharva, the answer, please.
Yes, please.
It's propionyl-CoA carboxylase deficiency, which leads to a buildup of propionic acid, not lactic acid. So that will be causing all these symptoms.
Hello,
And,
am I audible? I was lagging, I think. I'm sorry about that. My
yes,
net's-
you're audible now.
I'm really sorry. Could you explain that thing again? I didn't get it.
Okay, so it's the propionyl-CoA carboxylase deficiency. So firstly, odd chain fatty acids and all branch chain amino acids can't be broken down. They build up as alpha keto acids in blood. So that's how you lead to metabolic acidosis. Odd chain fatty acids are not metabolized. You get the neurologic defects. Failure to thrive and dehydration is a combination of both the acidosis as well as this being an early presenting disorder. Gene defects, so PCCA and PCCP, that's pretty obvious. Propionyl-CoA carboxylase, PCC. So no one scored in this round.
This
Yeah.
question.
Yeah. So I think I'm done with the biochem round.
So at the end of round 3, the final rankings are, if I would say, participant number 5, that is Prashant Saraf, is actually leading with 175 points. Following him, we have Paras Arora with 165 points. On the third position, we have Harsh Marathe with 145 points. Again, sharing the fourth position, we have the third and the fourth participant, that is Varun Pathak and Debayan Banerjee. And falling behind by a little bit is Ame Ambike with 105 points.
Okay. So over to you, Atharva.
Okay. So that was, I think the 3 rounds were interesting, guys.
Yeah.
Yes.
Okay. So please change your, actually, no, you don't need to change at the moment. Do not change your name. Do not change your private chat, because this round is the rapid fire. Okay. So have some fire inside and be rapid so that you do not miss on any question. Now the rules are different for this round, so I'll just explain. The questions are direct to a participant. It will start from the fourth participant, that is Debayan Banerjee. Okay. And for every correct answer, you get +5, and for wrong or past questions, you get 0. There is no pounds in this round. Make sure you do not write anything. It won't be of any use. And 5 questions will be asked to you verbally. It won't be displayed. You will be given 2 minutes to answer the entire 5 questions of 5 set of your questions. And after we start with the first question, to go to the next question, you need to either answer it or say pass. Otherwise, I won't be going on to the next question. You have to say pass. After all the questions are done, say 1, you answer 1, you pass 2, you pass 3, and then answer 4 and 5. You can come back to 2 and 3 if time permits. If you have 2 minutes, if you have your time from your 2 minutes share. Okay. If you answer a question wrong, you cannot retry it. If you pass a question, then as I said, you can come back to it. Are there any doubts for this round?
Okay, so there are only 5 questions here. It is not going to happen that as many as we can answer.
No. It's just 5 questions for 2 minutes per participant.
Okay.
Are you going to read out the question and then we have to answer it, or is it just going to be displayed? Or
no, it won't be displayed. I'll be reading it out. It won't be displayed.
Okay.
All the questions will not be displayed. No pounce. Make sure you do not pounce. Do not change your chat. Keep it to Souryadipta because you will need it in the next round. Okay. So if there are no more doubts, let us move to Deban Banerjee for the first set of questions of rapid fire round. Deban Banerjee, are you ready?
Yes, I am.
I'll start the timer by you.
Okay, so I'll tell you to start and you tell me to stop. Okay.
Okay.
Okay. So Deban, your time starts now. Name any 2 strap muscles supplied by the ansa cervicalis. Any 2?
Sternohyoid and superior belly of omohyoid.
Perfect. Name the nerve which is a content of the interpeduncular fossa.
Pass.
Okay. True or false? Oxytocin is not responsible for sperm ejaculation. True
Pass.
or false?
Pass.
Okay. True or false again? MHC2 is present on all nucleated cells. Major histocompatibility complex.
Pass.
MHC2. Okay. So Menke kinky hair disease occurs due to deficiency of which mineral?
Copper.
Perfect. Okay. So you want to come back?
The oxytocin question, it's true.
Okay. So you say oxytocin is responsible for sperm ejaculation.
Yes.
Okay. So it's perfectly correct. Name the nerve which is a content of the interpeduncular fossa.
The trochlear nerve.
Trochlear nerve. No, I'm sorry, it's wrong. Okay, last question that you have. True or false? MHC2 is present on all nucleated cells.
False.
True or false? That is correct. So you get 4 correct. Okay, well done. Sahasra, he gets a plus 20.
Yeah, noted.
Okay. These were the rapid fire questions will be like this only. They won't be very difficult, but you have to think quickly. So the next participant is Prashant Saraf. Are you ready?
Yes.
Okay. So the time starts now. Name the gray matter sandwich between the extreme and external capsule. Pass. Okay. Which germinal layer gives rise to the Kupffer cells of the liver?
Mesoderm.
That's correct. Okay. So what is the site of action potential genesis in a neuron?
Axon hillock.
That's correct. Prolactin acts via which receptors? Prolactin acts via which receptors?
IP3 DAG means G protein coupled receptor.
I'm afraid it's wrong. It's tyrosine kinase. Which of the okay, the next question is Selivanov's test is used to differentiate between mono and disaccharides. True or false?
False.
That's correct. So your first question, I'm going back to them. Name the gray matter sandwich between the extreme and external capsule.
Colostrum.
That is correct. That is correct. Okay. So I think, yes, you have answered all the 5 questions correctly. No, you have answered 4 questions correctly.
4.
Yeah. So it's a plus 20. Sahasra, can you please note that down?
Yeah, noted.
Okay. Next is Harsh Marathe. Are you ready for the questions?
Yes, just wait a minute. Tell me if I'm audible to you because I'm having slight doubt on my connectivity.
Yes, you are absolutely audible to me.
Okay, so we can start.
Okay. So your first question is, The scapular anastomosis is between the first part of dash artery and third part of dash artery, half for each.
Subclavian and axillary.
That's correct. The clavipectoral fascia is continuous with the dash layer of deep cervical fascia.
Prevertebral.
That's wrong. It's investing layer. Okay. The epithelial cells of Bowman's capsule are called as dash.
Podocytes.
That is correct. Barter's syndrome is characterized by defect of which channel?
Chloride channels.
Be specific.
Pass.
Okay. Name the two semi-essential amino acids.
Semi-essential. Arachidonic acid.
Amino acids, I'm saying.
Oh, amino acids.
But you have answered, so okay. Let's give you. Let's come back to the answer. Give the answer. Name the two semi-essential amino acids.
Pass.
Okay. So Barter's syndrome is characterized by defect of which channel?
BRT. Apart from this, I am having which question?
You are having name the two semi-essential amino acids, although you did attempt. So it would be unfair for the other participants if I give you a chance.
Okay. BRTC.
Please pardon?
BRTC channels.
No, I'm afraid. It is the NKCC channel, sodium potassium 2 chloride channels.
Oh,
oh yes. So you scored, if I'm not wrong, you scored
10.
1 and 2. Yeah, you scored 10. Okay. So it was the investing layer, as I said, and the two semi-essential amino acids are arginine and histidine.
Okay.
Okay. So now we come to which participant? We are coming to Paras Arora.
Yes.
Who all are done by this time? Debayan Banerjee, Prashant Saraf, and Harsh Marathe, isn't it?
Yes.
Okay. So Paras, are you ready for your rapid fire?
Yes, sir.
Be rapid, be fiery. Okay. So the first question: the thinner space of the hand communicates with the facial sheath of first lumbrical. True or false?
True.
That's correct. Again, a true or false question. In case of injury to spongy urethra in the bulb of penis, urine can reach up to the floor of axilla. True or false? Floor of the axilla. Injury to the spongy urethra in the bulb of penis, urine can reach up to the floor of axilla. True or false? Pass. Okay. So your next question: which amino acid, if present in excess, leads to niacin deficiency?
Tryptophan.
That's wrong. It's leucine.
Pyridoxine.
No, it's leucine. Wrong.
Leucine. Okay, fine.
Next question: what is the mucosal lining of thick ascending loop?
Cuboidal with microvilli.
Yeah, that's correct. Which component of the enteric nervous system, ENS, is responsible for secretions?
Secretions are the submucosal.
That's correct. So you had one past question.
Okay.
In case of injury to spongy urethra in the bulb of penis, urine can reach up to the floor of axilla. True or false?
True.
You say true, and it is true. So you answered 4 correct, right?
Yeah.
Yes.
Yeah, you answered 4 correct. So it's a 20.
Okay.
Okay. So the next participant is Amey Ambike. Are you ready for the questions?
Yes, sir.
Are you ready?
Yeah. Yes, sir.
Okay. So the first question, time starts. What type of joint is the temporomandibular joint?
It's a condylar joint.
That's correct. Name the arterial arc that connects the proximal part of the superior mesenteric and to the proximal part of the inferior mesenteric artery.
False. Pass.
Okay. Next question. What is the pacemaker of GIT?
Pacemaker of GLT. Interstitial cells of Kajal.
That's correct, although it is Kahal. True or false?
Yeah.
Theta waves on the EEG are seen in light sleep. True or false? Theta
True.
waves.
True.
That is correct. Okay, next question. What is the cofactor of superoxide dismutase enzyme?
Cytoplasmic or mitochondrial. It can be copper or manganese also.
So you have to answer about the cytoplasmic one.
Cytoplasmic
In fact, you are saying copper and manganese. I give you marks for that.
Okay.
Thank you.
Yeah.
So
I have one past question.
There was one past question. We come back to that. Name the arterial arc that connects the proximal part of superior mesenteric artery (SMA) to the proximal part of the IMA (inferior mesenteric artery).
Marginal artery of Drummond's artery.
No, actually not. Actually not. It is like you could have get confused with that, but it is actually I can't give you marks because I have specifically mentioned arterial arc. So your questions are done. You get a.
Gets a 20.
He gets a 20. Yeah, he was only one wrong. The answer is arc of Riolan. Have you heard of it?
Oh yeah. I've heard of it. Yeah.
Exactly.
I didn't. Yeah.
Okay, no issues. So it's a plus 20 for Ame Ambike as well. Varun, the last participant for this round. Are you ready for your question?
Yes. Am I audible?
You are absolutely audible, Varun.
Yes.
Can we start?
Sure.
Okay. So your time starts now. Name the two contents of inguinal canal in females.
The round ligament of the uterus and the remnant of the processus vaginalis.
That's correct. Which bronchopulmonary segment is the most dependent segment in supine posture?
The sixth, the superobasal.
Name it.
The superior basal.
That's correct. Okay. Spice or chili, that is the tikha thing. That sensation is not a taste sensation. True or false?
True.
That's correct. Which part of Wernicke's area is related with music?
Pass.
Okay. Last question. Which enzyme of the gluconeogenesis pathway is absent in muscles?
Glucose 6-phosphatase.
That's correct. So your past question. Which part of Wernicke's area is in relation with music or is associated with music? Part of Wernicke's area associated with music.
Do I have to say the Brodmann's area, the number of the Brodmann's area?
No. Wernicke's area itself is the Brodmann's area. One of them, kind of.
Auditory association area.
I'm sorry, that's wrong. So you get a plus
I didn't
20. The answer is planum temporale.
Okay, I didn't have an idea about that one.
Okay, that's fine. You gave quite good answers. Acha, so marking has been done, plus 20?
Yeah, it's done.
Okay, so can you tell what is, if spicy and chili sensation is not a taste sensation, what it is actually?
Pain.
Anybody?
Pain sensation.
Pain sensation.
That is correct. Many people don't know this. I am glad that you guys know it. Okay, so that was the end of the rapid fire round. It was rapid, it was fiery, and you guys are awesome, I must say. Over to you, Sasha, for the marks, and then Shoujo can take up the fifth round.
Okay, so leading the pack, we have Prashant Saraf with 195 points. Closely following him is Paras Arora with 185 points. Third, we have Harsh Marathe with 155 points.
Okay.
And again, the fourth place is being shared by Varun Pathak and Debayan Banerjee with 130 points each. And close behind them is Ame Ambike with 125 points.
I have a doubt that me and Prashant were only 5 marks different in the last round. And
no,
in this round,
actually not. I will actually send you the breakup if you want.
okay. Because in this round we both scored same marks.
Yeah. In the previous round you had a difference.
Because last time you told 5 marks.
Last round it was 165. It was like you were at 165 paras and he was at 175.
Okay, fine.
Okay, Souryadipta, can you take up the round 5 now?
Yes. And fortunately or unfortunately, few of you may have gotten a hint of what this round will be like. So give me a minute. I'm having some net issues. Can you hear me, all of you?
Yeah,
Yes.
you are
Yes.
audible.
Yeah, give me a minute. So sorry for the delay. Yeah, can you hear me, all of you?
Yes.
Yes.
You're audible, but
So-
probably I cannot send you messages.
Okay. Am I? Yes, I am a co-host. You can send me messages.
Yeah.
Souryadipta Majumdar QM is not in this meeting. That's the message
is
that
there.
I am getting.
Can you refresh it? Can you refresh the list once? I got logged out due to my network.
How should I do that basically?
You just close the chat and refresh it.
Is there any specific button to refresh or?
Try select Atharva,
You can answer
send any
me.
message, and then select me back.
See, I am able to send to Atharva. Yes, now I can send you.
Okay.
Yeah, perfect.
Have you received it? Please check if it's right.
Yes, Harsh. Yes.
Okay. Thank you. Sorry for delay.
So yes. So can we get the rules, please?
Oh yes, the rules are there.
The rules are pretty much the same as rounds 1, 2, and 3. The total time per question is 45 seconds rather instead of 30. And you need to pounce within the first 20 seconds and not 10. The marking scheme is the same. The questions are riddles. And for our audience on YouTube, there is a surprise at the very end, if I have remembered to keep it. If I haven't, then sorry. So question 1 for I think Varun. I
Prashant.
think we're gonna start
Prashant.
with Prashant. Yes.
Prashant.
Yes,
So
I am ready.
first question for Prashant. Can we have it on our screen? High levels are good, unlike my cousin. In blood, I am picking up lipids. A measure of health, I help in reverse. A transporter, I'm always A1. Time starts now. Pounds. If you're gonna pounce, be totally sure.
Pounce time is up.
Okay. Prashant, do you have an answer?
Yes. HDL.
Yes, correct.
Correct.
And-
Actually, I was not able to pounce because when I put it in the chat, it showed not available in the meeting.
Yeah, actually, I could see him. He was trying to write the answer. He's not lying about that.
Okay,
But
did he send it to you?
No, he didn't send it to me, but he was trying to type because I could see his hand trying to type on the video.
But then I'm sorry, but can everyone just check once if they can send me a message?
I pounced. Is my answer visible?
Hello, I have pounced.
Yes.
I have also
So
pounced.
I
also
will.
pounced.
Yes. Okay. So I'll. So Harsh is correct. Participant 6 gets plus 15. Debayon 4 gets plus 15. Ame gets plus 15. Paras gets plus 15. Varun Pathak gets plus 15. Oh wait, Amay, I think you tried twice. I'll take your
Actually,
first.
I was typing the same message, but it got
I'll
sent.
take your first answer only, so it's plus 15.
Yeah.
So 6, 4, 2, and 1 get plus 15, and 5 gets plus 10.
Actually, I am currently not able to message you. So should I message Atharva sir?
Just like switch over to
Yes, do the
Atharva.
same thing. Message to somebody else and retry.
Yes.
I had the same problem.
Repeat the scores once more.
Okay, I'll repeat while
1,
you try
2,
that out.
1, 2, 4, and 6 they got plus 15, and 5 got plus 10. If I'm not wrong.
I got plus 15 too. 3 participant 3.
Yeah, 1, 2, 3.
Paras 1, Amay 2, Debayon 4, Harsh 6. They got plus 15.
Participant 3.
What about Varun?
Varun is also saying that he has marked.
Oh yes, it's Varun. Sorry.
Okay.
Yes, Varun.
So 1, 2, 3, 4, and 6.
Yeah.
And 5 gets plus 10.
Done. Noted.
Yes, the answer is HDL. Yes. So everyone can message me now, I guess. And with that, I'll move over to participant 6. Can we have the question on the screen? My width is more than my length, the foregut I supply. Lying at a junction, having 3 children, the first of 3 I am. Pounds time starts now.
Hello, I have pounced it.
Okay. I think all of you have pounced, right?
I did it twice actually. First time the spelling mistake was there.
Yeah, I got that. Yeah. Varun, Prashant, Harsh, Amay, Paras, Debayon. That's all 6 of you, right? So yes, all 6 of you get a plus 15. Debayon 1, 2, 3, 4. Wait a minute. Varun 1, Prashant, Harsh, Amay, Paras, Debayon. Yeah. All 6 of you gets plus 15.
Okay.
Now, question for Paras Arora.
Yeah.
Are you ready, Paras?
Yes.
Can we have the question on the screen, please? A halfway point, I delay the passers. Controlled by my superior, I rest near the divider. One category of my block can be named Wenke block. Time starts now.
Pounds time is up.
Should I say the answer?
Yes.
Anterior bundle branch.
No.
Okay, the bundle of Kent.
No.
Then I have no idea.
Okay. Just without points, I'm going to give you some hints if you want to try. So a halfway point, I delay the passers. Rest near the divider refers to a septum.
Okay, AV node. Fine.
Yes, exactly. Exactly. But I'm sorry, I can't give you the point
I
for
got it,
this.
Yeah. Understood.
So also also Harsh, Prashant, Debayon, and Amay. So that's 6, 5, 4, and 2 have answered correctly on pounds, giving us plus 15 for them.
Noted.
Okay. So question for participant 2, Amay.
Yeah.
Your riddle is Atharva. I am very basic, yet I hold your code. Modify me, I do an epigenetic transform. Named after an amino acid whose derivative makes you livid. Pound time starts 1 second back.
Pound's time is up.
Okay.
Yeah.
Amay, do we have an attempt?
Tryptophan operon?
No. How can a tryptophan operon be basic? Like operons are complex things, right?
Right. I am very basic, yet I hold your code. After an amino acid whose derivative makes you livid. Derivative makes you livid, it is a neurotransmitter which angers. So basic.
The amino acid derivative makes you livid.
Yeah. No idea.
Okay. So we have one correct answer by Harsh. Harsh, would you like to explain this if you want?
Yes, I am very basic, yet I hold your code. So basically, code refers to genetic code, so DNA. So DNA is held by histone proteins. And modify me, I do an epigenetic transform. So that is clear. Amino acid is histidine, but I don't know the derivative.
Histidine derivative.
Histamine.
Yes, livid means red.
Histamine.
Yes,
okay.
exactly.
Yes.
So only I think Varun, right?
No, I
Harsh.
didn't.
Harsh, yes. Sorry. So Harsh gets plus 15.
Yeah, noted.
So Atharva,
Yeah, we can move on to the next question.
next, give me a minute. Next one is for Varun, right?
Yeah.
Yes.
Yeah. So Varun, your question on the screen. Cut me in the middle, you still see straight. Cut off a forelimb, one eye is gone. Cut off a hind limb, a field is gone. A gap in my name, try to find me out. Pounds time started 3-4 seconds back. Hivani, please make
Yes,
note of
we had
that.
started. Pound's time is up.
Varun, would you like to try?
Optic chiasma.
That is correct.
And that's a correct answer. Would you like to explain it for our audience?
So if you cut off one forelimb, you'll
Atharva,
lose.
can you please go back to the riddle?
Oh yeah, sorry.
Yeah, go on, Varun.
Yeah, so if you cut it in the middle, you will still be able to see straight because it's just the nasal fibers that will be cut. Yeah, the nasal fibers will be cut, so the temporal field of vision will be lost. Then you cut off a forelimb, one eye is gone because the nasal as well as the temporal fibers of that eye will be cut. And you cut off a hind limb and you'll have contralateral hemianopia.
Correct.
And I didn't really get a gap in my name part.
That means that it has two words, optic space chiasma.
Okay.
And also chiasma comes from the word chiasm, meaning a canyon.
I thought that.
Exactly. That is also there.
Yes. So I think so Varun got a plus 10 and Prashant, Paras, Harsh, they got plus 15s.
Okay.
Participant 5, participant 1, participant 6. Sahasra, noted?
Yeah, 156, noted.
Yes. And the last question for Debayon. Can we have it on the screen, please? Like a snake I am, 7 times through. Bound by peptides, number of 10s I increase. Of 3 types, in blood I can increase the level of glucose. What am I? I am aiming at a structure. Shivani, pounds time started about 3-4 seconds back.
Yes, Bhaiya. Keeping the track.
Okay, thank you.
Pounds time is up.
Okay, Debayan, do you have an attempt?
Somatostatin, maybe. I'm not sure about this.
No.
No, I have no idea.
Okay, I'll give you a hint. This is without points. An alternative term for snake is serpentine. Something snake-like can be called serpentine.
No, I'm not able to recollect it. Sorry.
There are a lot of camps there are a lot of tents in a camp. Still.
It was also named once in the rapid fire round.
G protein coupled.
That is
Yes,
correct.
yes, but we can't give you points
And
for
give
that.
you marks for that.
So,
the snake had me.
Pardon?
Yeah, the snake had me. The first statement.
Yeah, yeah, but Paras and Harsh, you get plus 15. So 1 and 6.
Even I pounced.
Yes, but unfortunately,
I get it.
G-protein is a very general term. I was looking for the GPCR.
Yeah.
I'm sorry for that.
Hello. There's one question I didn't get. Can you
Yes.
just show the riddle?
Which one?
What was that 10th thing?
Tent. Oh, I was referring to camp.
Camps.
Yeah.
Cyclic end.
GPCRs
Okay.
increased camp levels.
Number of 10.
So I put it in quotes.
Yeah.
Okay.
Yeah.
So I think I do have a bonus question for our audience on YouTube.
Yeah, we do.
No, I put that. If you can go to the next slide. Yes. This is for viewers on YouTube. Near the trachea I remain. Insignificant normally, for safety I prevail. Supplied by a vagal branch, I open some chords. A common Viva question, don't get me wrong. Participants can DM me on Zoom the answer, but you won't get any points. No, that's wrong, Harsh. Sorry. Amay, that's right.
Yeah.
Yes, Paras right. Varun also right. So we won't reveal the answer now, obviously. And with that, my watch is over. Over to Atharva for the finale. Thank you,
Okay. First of all, we need to know the marks.
Yeah, before
Sasa,
the
could you
finale,
please do me the favor?
Minute to just compile it once.
Definitely.
Also, there is no pounds for this round.
Yeah,
so
sixth round
there's
doesn't
no
have
need
any
to
pound.
change that. Yeah.
Okay, this is really, really interesting now.
Okay.
So one thing I would like to say, like, yeah, Harsh got all the riddles correct. So that's something, and that too in pounds. So that boosted him a lot. So in the first position, we still have Prashant Saraf with 250 points. Tying in the second position, we have Paras Arora and Harsh Marathe with 245 points each. And with 170 points, again tying, is Ame Ambike and Varun Pathak. So sorry, my mistake. Third position, we have Debayon with a 175 points. And in the last position now, tied are Ame Ambike and Varun Pathak with 170 points each.
Okay.
Excuse me, the voice actually cracked. I could understand that me and Paras are having same marks. What are Prashant's marks and what are our marks basically?
Okay, she'll repeat once again.
I'll just repeat it. First position is Prashant Saraf with 250 points, 250, right? Second position, Paras and Harsh with 245 points. Third position, there is Devayan Banerjee with 175 points. And again, the last position we have tied Ame Ambike and Varun Pathak with 170 points.
Yes, it's
Are the participants clear with the points?
Yeah.
Yes.
Okay. So the last round is the connect the dots. Okay. So this is an interesting round, and this has a very different kind of rules and scenario as till now what we had. So you must all remember your marks. Okay. So I would like to know from Sahasra or from Souryadipta, out of second and third participant, Ame and Varun, who answered the max questions and the riddle round? Ame.
I didn't keep track of that. Sorry.
Ame and Varun.
Yeah.
So Ame had answered 3 questions.
Okay.
And Varun also had answered 3 questions, but one was his direct question.
Okay. And Ame had answered all 3 pounces.
Yes.
Okay. Okay. Acha. So what we will do is, in this round, actually, we are having 9 questions. Okay. 3 from each of the 3 subjects. Okay. And the person who is at the lowest will get the first chance to choose. It is actually kind of a boost up round for the participants. Okay. So the participant who has the lowest score at the time will be given the first chance to choose a subject. Okay. And a question number. So each subject has 3 questions. So question 1, 2, or 3, you have to choose at random, whichever you want to. And then we will move on to that particular question. Okay. So what the rules are that each question has 3 clues, which will be given sequentially.
Pardon me, can you repeat or just wait a minute? I am having some problems connectivity probably.
All right, Harsh. Am I audible, Harsh? Give me a thumbs up if I'm audible, Harsh.
You may try disconnecting your audio and then reconnecting again.
So am I back in the meeting?
Yes, you are. Am I audible to you, Harsh, now?
Yes, you are clearly audible.
Okay. Am I audible to all the participants? Because this is
Yes.
important to know the rules of this round.
Yes.
Please repeat.
Atharva, before you start, I'd like to give out a shout out to Souryadipta Basu, Mojamel Hek, and Shayantan Basu, who got that last riddle correct. It is the posterior cricoarytenoid. Thank you, you 3. You get brownie points.
So prepare a brownie at your home and eat it, isn't it?
Yes, surely.
So round 6, I'll repeat the rules. Okay. The round 6 will be having 9 questions, 3 questions per subject. Okay. The participant having the least number of points, or the participant who's standing at the lowest rank at the moment, will get the first chance to choose a subject of his choice and a question at random of his choice from question 1, 2, and 3 of that particular question, of that particular subject, sorry. Okay? And based on that, we will move on to that particular question of that subject, and he will have to answer that question. There will be no pounds in this round. Each question has 3 clues which will be given in a sequential order, and if you answer correctly just after the first clue, you get 30 points. If you do not answer, that is if you say pass, or if you answer incorrect, then we directly move on to the second clue, and you get 20 if you answer in the second clue. If you still answer incorrectly or you pass, then you go for the next clue. If you answer in the third clue, you get a 10, and if you do not or if you pass, then it is 0. There is no negative in this situation. Okay. And after every question, after every clue, you get 30 seconds to answer. Are the rules clear to everybody?
May I ask something?
Yes, please.
Means we have to answer one question which is having 3 clues from each subject.
Yeah. No. It is, you will have to choose a particular. I'll just move on to the next slide. So you see there are 9 questions, 3
Yes.
from each subject. The person who has the least marks will choose a particular subject of his choice, and at random he can choose question 1, 2, or 3 of that question of that subject, and we'll move to that question. That question will be of that particular subject only, and it will have the 3 clues. If you answer according to the clues, you get 30, 20, and 10. If you do not answer, or if you answer incorrectly, I will move on to the next clue.
Yes, means we have to answer one from anatomy, one from physio, and one from biochemistry.
No.
Only one out of 9.
Only one question per participant.
Okay, got it.
Okay.
So without the clues, we'll get 30 points, right?
No, you get the first clue and you get 30.
Okay.
If you get at the first clue. If you don't get at the first clue, then 20 in the second clue. After the third clue, you get 10. And if you don't even get at the third clue, then you get a 0.
0.
There's no bounds.
There's no negative, like even if we answer incorrectly after the first clue.
No. If you answer after the first clue incorrectly, I'll move on to the next clue.
Hello. Hello. Am I
Yes,
audible?
Harsh. Yes, Harsh, you're
Actually,
audible.
I have 2 doubts. I'm not clear with the sequence. So, what will be the sequence right now? Is the sequence based on points, or is the sequence based on the earlier numbers chosen?
The sequence will be based on the marks. The current marks.
So first question will go to Amaya.
In the increasing order. The lowest marks will be getting the first option to choose. It's like the bonus round for the person who has less marks to score and come at par with the others.
Okay, got it. So the sequence is clear to me. So first question will be to Amaya, then to
I'll be before you. Bas itna pata hai.
Okay, that's right. That's fine. And the second thing that I want to ask, if I answer at the first clue and my answer is incorrect, then can I dismiss it later on that I don't want the answer?
Yeah, you can. You can change your answer also after the second clue or after the third clue also.
Okay.
You won't be awarded any negative marks.
Okay.
So is everybody clear?
Yes.
Okay.
Yeah, but among me and Varun, who goes? Because, like as you said, we have the same
both are
points
having
and,
170 marks. Yes, exactly.
Yeah, exactly.
So, Shoryu, can you help me, Shoryu? How do we choose out of these 2? We can have a bonus question so that the one who answers will go later.
Or I can use one of my tiebreakers.
Yeah, we can do that.
Okay, so who are the ones tied?
Amey Ambike and Varun Pathak. 2
okay,
and 3.
Unmute yourselves. Right.
Yes.
Okay, so tell me.
Shoryu, the one who answers goes first, or the one who does not answer goes first?
The one who answers goes first.
Okay.
One who answers goes first. Rate limiting enzyme of the Krebs cycle.
Isocitrate dehydrogenase.
Yes, correct.
Okay.
So Amey goes first.
Okay. So Amey, it's your turn. Choose the subject and the question number.
I'll go with physiology and question 2.
Physiology, question 2. There you go. You have to identify this person. All right?
Okay. Yeah.
Your first clue. And after I reveal the clue, your 30 seconds will start.
Yeah. Okay. That's
I
a
hope
clue.
the timer is being kept.
Yes, bhaiya.
Is that a clue?
That is the clue.
Okay, pass.
Okay. Next
Pass.
clue.
Pass. Claude Bernard.
That is correct. So
Claude
he gets
Bernard.
20. He gets a 20. He gets a 20. So the last clue was that he is known as the father of physiology. Okay. So it's a very common person to be known. Okay. The answer is Claude Bernard. Okay. So next is Varun Pathak. Are you ready for your choice?
Yes.
Which question, which subject?
I'll go for physiology as well. Question 3.
Okay, let's move to question 3, physiology. Identify this technique. Okay, you have to connect the dots. Remember, you have to connect the dots.
Yes. Testing the osmotic fragility of a red blood cell.
No, it's wrong. I'm sorry, it's wrong. It's not even close. I'm very, very sorry.
Okay, pass. Yeah.
Hello, there's one objection. You should not reveal if it's right or wrong, because then the negative marking thing goes out of question. No?
No, we don't have negative marking though.
If all three are wrong, there won't be any negative.
No, there won't be any negative.
Okay. Okay. Sorry for interruption.
Okay. Is the timer being kept?
30 seconds over.
Okay, so you get the third clue. Connect the dots. Connect the dots. These are 3 random images. Connect them. 3, not actually 2 images with 1 word.
It's the law of conservation of mass, but I don't know the technique.
Time's up.
No,
Time's up.
I don't know.
Okay, so I'll give you some hint, Varun. This is you're not getting any marks, obviously, but you see the first one is a dye. The second is something known as dilution. It's a dye dilution method for the estimation of amounts of the body fluids. Okay.
Yeah, I didn't remember the name of the technique. I got
so
what
the
it was.
answer is dye dilution method. Okay. So the next is, I think, Debayan Banerjee.
Yeah.
Are you ready, Debayan?
Yes, I'm ready.
Which subject, which question? We are left with 3 anatomy, 1 physio, and 3 biochem.
Biochemistry, question 1.
Biochemistry, question 1 up for you. You have to name this compound, connect the dots, connect the images. The first clue, time starts.
Dermatan sulfate.
That is correct. That is correct. It is derma, then tan, and then sulfate. So this is the structure. And the third one, it is a type of glycosaminoglycan found in the heart valves, also in the skin. But I didn't want to give it as a direct answer, so I had kept it as the heart valves in the third clue. That was a very quick answer. I'm really, really
Within
impressed.
15 seconds, he answered.
That is a really quick answer, Devayan. The next participant will be Paras and Harsh, right? You are again on a tie.
They're again on a tie.
Yes. So, get your microphones on. I ask you a question, you have to answer. The one who answers first goes first. Are the two of you ready?
Yes.
Yeah. Okay. Which nerve supplies the flexor digiti minimi of the foot?
Posterior tibial nerve.
Pardon?
Lateral plantar nerve.
You are correct. Who answered lateral plantar nerve?
Me, Paras.
Okay, so Paras, It's you who goes first. Okay. Choose your question. Choose your subject.
Anatomy second.
Anatomy second. We are left with 3 anatomy, 1 physiology, and 2 biochemistry. Okay.
Second.
Oh, sorry. Okay. Identify the muscle. Okay. Connect the dots, connect the images, identify the muscle.
Levator superioris alic nasal.
You're close. Make it correct. Answer once again.
Levator palpebris superioris alic nasal.
You are not absolutely right. I have to give
30
to the
seconds
next.
up.
I have to go for the next thing. Your answer is you're very close, but you are not answering the correct thing. One word is different. One word should be different.
Levator palpebris alic nasal.
No, it's not that. It forms the nasolabial folds. Nasolabial folds is formed by it.
It's levator.
You are very close, dear. You are very close.
Angularis.
I'm afraid you are very close. It's levator labii superioris alicinesi and not levator palpebris superioris alicinesi.
Right, yeah.
Okay?
Yeah,
That's why I was emphasizing on nasolabial fold. Okay?
Labial, yeah.
Okay, so you do not score anything, Paras, I'm afraid.
Yeah.
Okay, so we have next is Harsh Marathe.
Okay, so may I know what all are left?
You have question 1 and 3 of anatomy, and you have 1 of physiology and 2 and 3 of biochemistry, right?
Yeah, I will go with question 1 anatomy.
Question 1 anatomy for you there. You have to identify the scientist, okay?
Okay.
First clue, the picture.
Robert Koch.
Robert Koch. I'm afraid not. You are not even close.
Rodman.
That is correct. By the way, can you give the full name? No, Mane, it's just I am asking for. You are getting the marks. You're getting 20, but I'm just asking if you can give the full name.
I know it, but I'm not recalling right now.
Well, the next clue was the Broadman's areas. And
can you just tell the first letter of name or something so that I can?
K. It's K.
Okay, I don't remember.
Okay, it's Corbinian Broadman.
Corbinian.
Yes, it is. So
I get 20.
You get 20, absolutely.
Thank you.
That has been noted?
Yes, it is.
The last participant, actually the first part, the first person in ranking is Prashant Saraf. Are you ready, Prashant?
Yes.
Am I audible? Am I clear?
Yes.
Okay. Which question?
Biochemistry, which 2 questions are left? Biochemistry, which 2 are left?
Question 2 and 3 we are left with.
Oh, okay. Question 2, biochemistry.
Okay. You have to identify this law, okay?
Yes.
It's an easy one.
Beer's law and Lambert's law.
That is correct. 30 for you. So it is used for analysis of mixture by spectrophotometry without the need of extensive pre-processing of the sample, and the formula is A equal to epsilon Cl, where C is the concentration, L is the length of the path.
That was some amazing quizzing.
Beer Lambert.
Amazing quizzing.
Amazing. It was. So
okay.
Let us just see the other questions. Do you want to see other questions?
Yes. Yes.
We can have it for the audience.
Yeah, we can.
I'm monitoring the YouTube.
Okay. So
So we have to
3 of
answer
anatomy.
on personal chat.
You can. Anybody, you just DM either me or you can DM Souryadipta. You don't even need to change. Okay.
But these won't have points though.
We don't have points.
These are just for fun.
These are just for fun. So the foramen.
Okay.
Paras Arora has given me a very correct answer.
I should have taken this one.
Now that's what the thing was. It was kind of a luck round also.
I think Atharva, you can reveal the next clue now.
Yes, I did. Its clinical importance is that infections of the nose and the nearby areas can be transmitted to the meninges and the brain from what is known as a danger area or danger triangle of the face. So
last clue. Yeah.
Last clue is the articulation of frontal bone and the ethmoidal bone. And if the patient, and if it is patent, it gives passage to the emissary vein from the nose to the superior sagittal sinus. Okay.
All the participants except Harsh, who messaged me, are right.
Okay. I got a message from Paras and he was right.
Harsh, it's not anterior ethmoidal foramen. And shout out to Subhangani Ranjan, sorry if I mispronounced your name, Abhirup Sarkar, Supratik Pal, and Mojamel Hek for their correct answer. It is foramen cecum.
It is foramen cecum. Okay, so let us return to the first slide and let us see the physiology question number 1. We have to identify the equation that's given in the first clue. It's an easy one.
Varun, you're right.
Paras, you are wrong.
Yes, Amay and who is it? Prashant and Debayon, yes. On our YouTube, Shopnonil Chaki, you're right. Shantan Basu, you're right. I think we can reveal all the 3 options because people have given us the answer.
Yes, it is the Goldman equation or the Goldman-Katz equation, as we better know it.
So,
Sastra, is the tallying up done?
Yeah, it's all done.
So, do we have any ties? If we don't have ties, we'll reveal the last question. Otherwise, we'll keep it as a tiebreaker.
No, we don't have ties.
Okay.
Clear cut.
The biochemistry question 3 is you have to identify this technique.
Okay, I'll be honest, even I don't know this.
Then you can also try and DM it to me.
Fellow quiz, yes. Yes, Varun, you might be right. Prashant also, but I am not sure myself. So,
okay, so you DM your answer to me, what they are saying, so that I can say whether they are correct.
Sure.
Did my
Harsh,
answer
you are wrong.
Atharva?
Paras, you are actually, no, it's not what you are saying, Quizmaster Souryadipta Majumdar.
Okay.
Okay.
Okay, SAMSA has given me an answer, and that is correct. I mean, it was, if I'm not wrong, it was Ipshita who gave the answer.
Yes, I've been watching the entire quiz without saying anything.
That is what I say. That is what the thing is. IT team should be given a hats off on the live event. A compound called Cefadex is used for this procedure, is the next clue. Cefadex is actually dextrin. If that gives you an answer. Harsh, you are correct, but kindly give me the complete answer. Yeah, it is correct. It is correct. Nihal, you are not absolutely, you are not correct. You got the first part, but not the second one. Varun is correct. The third quiz, it is a filtration procedure based on the molecular size.
Oh.
Souryadipta, what's happening on the YouTube live chat?
Shopnonil Chaki, gel filtration chromatography, Prakriti Jain, gel filtration chromatography graph, Pranita Jadhav, gel filtration chromatography, Alap Chaudhary, gel filtration type, Santan Basu, gel filtration chromatography, Subhankini Ranjan, same, Abhirup Sarkar, same, Mojamil Haq, same.
Oh, good. So everybody who has the same is correct. It is gel filtration chroma, means color, and graphy. That's the graph. Okay. So it's gel filtration chromatography. So that's the end of the quiz, and I hope the participants have enjoyed the event.
Yes,
the
a lot.
questions,
Yeah.
Yes.
were the questions interesting?
Yes.
Were they monotonous?
No, not
No.
at all.
No, not at all.
No.
So that's really good that you guys enjoyed the event, and I would like. So are we really revealing the results, because already we have it?
Yes, we
reveal
can
the
reveal the results,
But
and
the prize won't be revealed yet.
What?
What?
We will reveal the results and the positions, but the prizes will not be revealed today. They will be revealed tomorrow, actually, at our valedictory session.
Valedictory session, definitely.
So, should I reveal the results now?
Yes, please.
Yeah.
So, after 6 awesome rounds, thanks to our brilliant quiz masters, Souryadipta Majumdar and Mr. Atharva Batwe, we have the final results. Drum roll, please. And in the first position, we have Prashant Saraf with 280 points. Okay. Great.
That needs that definitely needs applause.
Thank you so much.
In the second position, we have Harsh Marathe with 265 points. Close.
That was
Wow.
close.
Wow.
One shout out to Harsh for completely destroying my riddles round.
Absolutely.
Absolutely.
And in the third position, we have Paras Arora with 245 points. That's close. Really close. And the fourth position, we have Deban Banerjee with 205 points. Fifth, we have Ame Ambike with 190 points. And last position, unfortunately, it is Varun Pathak with 170 points.
But guys, you guys fought a beautiful battle, so nobody should be disheartened, because it was beautiful event and we enjoyed actually taking the quiz.
Actually, yes.
Yeah.
I actually wish I knew as much as you guys do in my first year, honestly.
Honestly, I do wish the same. In fact, if I had studied this much in my final year, now at the current, I would be having honors in my prof.
And we'd like to put a shout out for Nihal Saha, our proctor for the quiz, who has been very surreptitiously observing you guys for any signs of unfair means. Thank you, Nihal. Thank you, Shivani, for keeping everyone's time. And
thank
a
you,
big
Sahasra,
shout out to Sahasra for the point.
And none the least, thank you, Ipshita, for from the IT team for hosting the event.
Thank you so much. It was My pleasure to have you all.
Okay, we also have our organizing chairperson here, Ashmita Di. Please add
Ashmita
something.
Di, yes.
Didi, if you'd like to say a few words.
I don't have actually anything to say, but it was an amazing quiz with amazing quiz masters, Souryadipta and Atharva, and you guys definitely know a lot for a first year.
Okay, so I request everybody to please switch on your video so that we can take a screenshot of the event.
It's done.
Okay.
So with this, we should end it, right?
I would like to request all of you to please join us for the MedCon that we have starting now. And we have an amazing keynote lined up by the bone teacher.
By Abbas
Please,
Ali
we would love to
sir.
have you all for that session. Yeah.
So can I ask one
Thank
thing?
you so
I'm
much.
not clear with how those keynote certificates you are giving. When we have to, where we'll get the form and that.
The forms are mostly put up on the YouTube chats if you're watching it on YouTube, and are given on the Zoom chats if you're watching it on Zoom.
Yeah, please give on the Zoom chat.
Yeah.
Okay. And if we attend all 6, then only we are going to get certificate for that.
Four. There are 4 Zoom. There are 4 keynote speeches.
So there will be no individual certificates because I have already missed one. So
we are actually planning to give it to only those who have attended all of them. But we would definitely be considering it, and you must join the next session because it is the best keynote speech probably.
okay.
Okay. So let's dissolve the meeting and let us